The number of prescriptions that are written for opioids really is quite phenomenal. Over the last 5 years that we have data available to us, it works out to be about 37 million prescriptions, and that's just in Tennessee. To put that in perspective, on a per-year basis, if you were to lay out the prescription pads from Knoxville out into the distance, it would actually stretch from Knoxville all the way out to New York using those 6-inch prescription pads.
Wow.
Yeah. And so we're talking about a lot of prescriptions. And in fact, thinking of it a different way around, if you think of the bottles that these prescriptions would be placed in, it's actually enough to fill up about 1,850 pickup trucks. And if you place them down all in Knoxville, it would actually essentially fill up all of I-40 between campus down to Campbell Station Road. This is aggregated over the 5-year period, but we're talking about a really big problem.
That's like a huge traffic jam.
That would be a huge traffic jam, much more than Knoxville usually sees on a day-to-day basis. Yeah.
As you were looking through some of these statistics, is there anything that jumped out at you as particularly dramatic or surprising?
Yeah, if you look at one of the most recent years that we have available for Tennessee, about 1/3 of the population actually had a prescription at some point for an opiate, about 2 million unique users in 2011. And there's actually some pretty substantial differences depending on where people live. If you look at the prescriptions dispensed per capita, it's often about 1.25 to almost 2 times higher for people living in rural counties than in urban counties.
As you looked at this data, were there any other significant demographic differences that surfaced?
Yeah, there was actually a pretty big difference in genders as well. If you break it down based on gender, it looks like about 33% of women at some point were prescribed an opiate versus only 25% for men. Now, what's interesting, however, if you look at the overdose percentages, it turns out that nationally, men are about twice as likely to die from an overdose. So women are getting prescribed more often, but they're not dying as often due to these overdoses.
So what would be our best guess, say, nationwide? How many people are abusing these drugs?
Nationwide, we think that nearly 2 million Americans abused or were dependent upon these prescription opioids in 2014. And to put this in perspective, that's roughly the population of Houston, Texas.
Wow. Okay. So the Tennessee Department of Health tells us that opioid overdose deaths are now more common than deaths from vehicle crashes?
That's correct. In 2014, there was just under 1,000 people that died in traffic accidents. And if we look at the number of people that died from accidental opioid overdoses, that runs to about 1,260. So we're talking about 25% more deaths due to opioid overdoses than traffic accidents in Tennessee.
So a lot of these numbers we've been talking about today refer to the cost of opioid addiction and overdose in terms of human life. But is there any way to know the financial cost?
Yeah, we have some pretty good data on this from 2011. If we look at the people that are coming into hospitals to get treatment for accidental overdoses, poisonings, that works out to be about $29 million. Now, there's a lot of babies that are born to mothers who are addicted, and so treating these dependent babies works out to be about $37 million annually. And if you look at the people that are aware of their addiction who are coming in for treatment, that works out to be about $16 million. So the total cost comes to be about $80 million. And that's not even including any sort of cost due to lost productivity like days missed at work. Now, to put that into perspective, the recent renovation of the Henley Street Bridge was only about $32 million. A typical building, if we're going to build a new one at UT, is about $40 million. So you're looking at a loss of about 2 new buildings at UT or maybe 2 renovated bridges per year.
Thank you, Adam.
Thanks, Adam.
Thank you.